Hello, dear friends. Today we have an endodontist on our episode of Vice Dentist. He is Vice President of IACDE, Professor and Head, Conservative and Endodontic Department, NDC, Raichur. He has a thriving practice at Hyderabad. He is a gem of a person, and every time I speak to him, I get to discover something new. He loves dentistry and has very encouraging thoughts for upcoming and budding dentists. I'm sure you all will get lots of lovely chunks on wisdom. Few questions that are answered by Sir are how to set your root canal charges. He has shared few tips to excel in endo, be it handling flare-ups or what to do when there is a separation. He also spoke about how to handle window shoppers, discount and bargains. Trust me, it's a must watch, irrespective of whether you are a junior, you're a student or a senior dentist. Here I welcome Dr. Satish sir. Welcome to Wise Dentist Success Talks with Dr. Ravi. Here we have Dr. Satish sir. Thank you for being ready to share your wisdom with our fellow dentists. Welcome, sir.
Thank you very much, Dr. Ravi. Pleasure to be here with you. Yeah.
Thank you. Satish sir, we'll start with our first question directly. So, we all know that the COVID has done a lot of damage to people around us. It has been an uncertain time and low time for all. So, what is your message to our colleagues during this uncertain time?
COVID has really shown the value of life to everyone, each and everyone, whether it is rich or poor. So I would suggest everyone to not to lose their hope on life, and they should go on with a positive, move on with a positive note in the life. They should have an optimistic thinking, towards life. Nothing has gone wrong. Still, we have a lot of hope to get back to our things, normal things. So that's how you should go about it.
Good. As we all know, what it takes to complete a case of root canal treatment. Have heard
Yeah.
people saying endodontic work is not that rewarding. How do you take this?
Well, I don't admit this at all because being an endodontist, I should really talk good about my profession. But then root canal, yes, in India, in developing countries like ours, root canal treatment, even though it is such a meticulous job, such a intricacy, a job with such an intricacy, it is not been rewarded till date. But after COVID, I feel the endodontics has evolved. The patients are coming to understand the type of treatment what we are doing. The importance of the root canal treatment is emerged very well, and then you can show them all sorts of the latest gadgets and devices and the sterilization protocols what we are using. So it is very good prospective for an endodontic treatment.
Great. There is so much of hard work and patience beside having a good skill. But many of our clinicians they forget this while fixing their charges of a root canal. How to fix your root canal charges? My first question, and how to fix our root canal charges, keeping COVID into consideration.
Well, root canal is, as I said, it is a very very meticulous job with a very minute delicacies of the tooth. We are treating with the microscopic structures of the tooth. We have to keep that in mind and explain to the patient that we are dealing with non-visual microscopic structures of the tooth, and there are n number of anomalies in the tooth, in the canals. So we have to give the root canal that importance, and we have to project it in such a way that it is a very important and very hard procedure to do in a tooth. Unlike other treatments, which are also very hard, I don't deny that. But then root canal therapy is to be projected in such a way so that you can charge the patient accordingly. I feel root canal treatment should be charged well, You should not let down your own specialty work. You should keep that in a pace with other treatment plans of the dentistry. We have to charge good enough. And after COVID, I'm charging more because of I'm using more of sterilization methods. I'm using all the aseptic techniques. I'm using latest gadgets. I'm discarding the instruments as and when I use it for one or two patients. One each patient is we are discarding the instruments, and I'm charging more. There's nothing wrong in charging, and the patients are willing to pay for their health. After COVID, this has to be brought into both the clinician and the patient's mind that root canal therapy should be charged well enough, and you have to fix a particular charge, keeping all these factors into mind.
Amazing. So I move on to my next question, which says we all know people are now gadget freak. If I were to ask you, share a few must-have gadgets to enjoy endodontic work.
Yes, nowadays we have to change with times. When I started my practice way back in 2003, but I never had so many gadgets. I used to have a normal IOPA technique, which where we use a developer fixer. Now things have changed. During this past 10 years, the dentistry and endodontics have evolved. We have changed in terms of equipment. We've changed in terms of technology. We have digitalized everything. So there is IOP has changed into RVG now. There is digitalized radiograph. We have to have it. It's a must. Wherein you can see all the intricacies of the root canal fillings, the root canal therapies. You can take the working length. You can measure it on the screen. You can take a negative image of that, and you can measure it. You can diagnose it very well. So that is a must. You have to update yourself with all the technology and the latest gadgets. Yes, I do admit, but the basics of endodontics is a must. As a clinician, one should be thorough with the basics of access opening, and then right from access opening to the obturation techniques. As an endodontist, you have to have a basic knowledge of the basics. Then, along with your gadgets, with adjunct of all these latest gadgets, what you use, irrigation devices, endomotors, the latest files, the latest heat treatment files, rotary endodontic files, all that, you can do a very good job. And you will love the profession. You will love doing a root canal with all these things.
Amazing. And as we all know, taking consent is equally crucial. So, as per you, how important is taking consent in endodontic work, and what are the points to be mentioned in the consent specifically, if any?
First and foremost, as a dentist, as a dental specialist, it is a must. It is mandatory for us to take a consent from the patient. We have to explain to the patient what kind of procedure are we going to do to him, and we have to take their consent. That is the most important thing nowadays, whether it is general dentistry or an endodontic specialty work. And moreover, more so over, if you want to do an endodontic treatment, it is well and good that we inform the patient in prior about the endodontic treatment. Most of the patients are very, very apprehensive and skeptical about the endodontic treatment. They might have heard stories about endodontic treatment. The moment you say root canal therapy, people are, oh my God, root canal. No, I don't want to get a root canal done. So that kind of phobia is still there in the patients. And post-COVID, even more so. They don't want us to intervene into their tooth, into the blood of the tooth. So we have to explain to them thoroughly what kind of procedure we are doing and how aseptically we are entering into the tooth. And then the consent has to be taken in endodontics as well. And if you want to mention in consent form specifically about endodontic treatment, which I don't think is necessary. You can generally take a consent form in a generalized way. But then, if you really want to wish to add consent for endodontic treatment as well, yes, you can add the endodontic procedures as well. But don't keep it in detailed version of endodontics. In each step, you don't need to enter all the each stepwise methodology of the in the consent form, but just you can yes, you can add a word or two about the endodontic treatment, which is explained to the patient and take the consent.
How about mentioning the separation of file? I was talking to you the other day, and you gave a very
Well,
beautiful
yes, yes,
and hilarious
yeah.
example of a wife and father-in-law.
See, a separation of file is a nightmare for all of us, for even for a general dentist who does a root canal therapy, especially more so for an endodontist. If you separate an instrument and go back home, you won't even sleep in night, you know. So the separating instrument is a nightmare for an endodontist, which which can happen to anybody. It is a mistake which can be due to various reasons, due to the overusage of the same file. Nowadays, even though we have so many new technologies, new gadgets like endomotors with built-in apex locators, endomotors with a beautiful torque and specific torque for each instrument, speed for each instrument. Even then, we tend to do this mistake. Separation of file is bound to happen in anyone's hand, but it is always best or better to explain to the patient that after that happens. We have to tell them by ourselves. We have to educate them that this is what happened and it's just a mistake, and it is not something which can be it has to be explained in a proper way so that it doesn't harm both the patient and the clinician in any form. You should show them the radiograph where it is broken. Yes, if it is broken in a coronal third, we can try to retrieve it. In the middle third, it is difficult to retrieve it. In the apical third, you can actually leave it as a reattaperture and a filling material. But yes, we have to explain to them where exactly it is broken, how did it happen, and if any future repercussions of this mishap, we have to tell them that this can be rectified in such and such a form. Like we can do a hemisection, or we can remove, we can redo the root canal treatment. We can bypass the instrument. We'll try to do that. So we should give an assurance to the patient that yes, separation of instrument is happened, but then we will take care of you. That assurance should be given by you yourself to by telling him what has happened.
Okay, and I would want to know a few things about follow-ups. So, how important is endodontic follow-up, and how frequent, and how do we convey it to patient? I mean, follow-ups.
Well, initially, I'm just telling you casually, when I started my practice in back 2003, when I used to follow up for even for a normal scaling, people used to think that this fellow doesn't have any work, so he's calling us. So that's the mentality of the common Indian public. Whereas in the developed countries like in America, United States, then they go to dentist every month. The dentist office calls them every month for a regular checkups and all. And these guys they happily go there and get things done because it is insured, it's under insurance or whatever. But then that is a protocol there that is followed by everybody. So follow up is a must. Actually, follow up is a very good thing for both the clinician and the patient. It is just like getting your car serviced regularly. Why do you go to the car get your car serviced every 10,000 kilometers? Even if you don't go there, those guys will call you up and remind you, sir, your car has to come for a service. In the same way, we also have to have a follow up. We have to call the patient and call them back and get them to educate them. This is as long as you keep their teeth clean, there's no the dentist won't earn money. So that's the kind of follow-up we have to do. And especially for endodontic treatment, yes, if you do an endodontic treatment perfectly, and if you feel as an endodontist that will not give you any kind of a pain or any kind of a lesion develop in due course of time, you tend to lose the follow-up. You tend to not to call the patient at all. But if your treatment is not good, so like what you said, if you separate an instrument or if there is any lesion while doing a treatment, you have to have a follow-up and call the patient monthly once or a fortnight and see the whether the our treatment is taken up by the tooth or not. My tooth has to respond to my treatment. That has a must. A follow-up, endodontic follow-up, depending on the uh, pre-operative condition, is a must.
Amazing. I would want to know a few things or your suggestions or your tips on the following situations from endo point of view. So, if you could tell us things to take care while access opening.
Straight line access, point blank, straight line access. We have to get into all the canals in a straight line access. You cannot enter into any deviated form. No, every canal, every orifice has to be clearly visible to you with your naked eye. No, not everyone does endodontics under microscope. Not everyone does the endodontic treatment in the loops, magnifying loops. But even if you see the canal access after the access opening is done with your naked eye, I should see all the three canals distinctively. That is what is important as an endodontist. So if you open the tooth well, you'll close the tooth. Simple for me.
Okay,
If I open it good, I'll end up landing closing it good.
okay. Second situation, while taking working length.
Working length, yes. Uh, Tactile sensation of working length is not good thing. Don't be under the impression that I'm a endodontist being practicing for the past 20 years. I can see the working length with this like this. I can feel with my sensation, tactile sensation. No, don't be under the every root canal is very, 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 very notorious in its own way. Anything can happen in a root canal. You're a blind man entering into a dark room. You don't know what is going to happen inside there. So better take a radiograph. You have to take a radiograph in an RBG. You have to know where your file is going in each canal. You have to take the x-rays regularly for a proper working length. If my x-rays over, if my canals are overlapping, if the instruments are overlapping in the canals, if I can't see all the three canals distinctively, I have to take another radiograph and see all the working length properly. Working length radiograph is a must.
Okay. Things to take care while doing B.M.P.
B.M.P is another challenging task on its own. B.M.P is like it's like a movie. You have to. It's like an animated movie. Anything, it's just as going like a car race. You're going inside the canal with different kinds of gadgets. You're trying to clean. You're trying to shave. You're removing. You're flushing. You're irrigating. So many things at a time, all at a time. BMP has to be done in a very, very meticulous way, very, very systematically, procedural wise. You cannot skip any instrument uh, of that particular system. Whatever system you are using for a root canal therapy, whether it is Protec or a Profile or a latest Neo Endo, there are 64 different kinds of operating endodontic instruments in the market. Each systems manufacturer gives his own protocol. Some people have three instruments, some people have a single instrument, some people have four sets of instruments for the BMP. You have to follow that protocol according to that manufacturer, according to that instrument, and do the BMP very, very cautiously.
Okay. Things to take care while irrigating the canal.
Yes, irrigating a canal is a must nowadays. Gone are those days where you will think irrigation is done by saline, sodium hypochlorite, and again hydrogen peroxide, again saline. No, so irrigation is the protocols have changed. Irrigation devices have changed. There are new irrigation technologies. There is new irrigation protocol. We have to follow that. There is no point in irrigating with this hydrogen peroxide. Hydrogen peroxide doesn't help you in any manner. You have to use sodium hypochlorite. It is the best irrigant till date. If you want to use chlorhexidine along with sodium hypochlorite combination, this, that, that's again a different, everyone has his own agenda of irrigating. But my irrigating protocol should be such that I have to clean up the canal completely. whatever I'm debriding in the canal, whatever I'm scraping with my instruments in the rotary motion, whatever dentinal shavings are coming out, I have to irrigate them. I have to flush them out from the canal properly. And if there are side vented needles, you have to use the latest gadgets for irrigating. Nowadays, there are so many irrigation devices like Ultra X. I have bought a latest Ultra X, cheap and best. It's just 20,000 rupees. And you have a beautiful tips, ultrasonic tips for that. You put the solution in the canal and you use an ultrasonic tip, and it oscillates in the figure of eight motion. It creates the cavity, it creates the bubbles, cavitation effect. It cleans up the canal so well. And the post-operative pain is totally minimal. So irrigation is a very important aspect again.
Okay. And what is your suggestion on handling flare-ups?
Well, flare-ups are of different types. Flare-ups can be mid-treatment flare-up, post-treatment flare-up, and inter-appointment flare-ups. You have to treat the flare-ups accordingly. If you have a flare-up is a flare. It is just like you going home drunk and your wife is flare-up. It's this flare-up. It can happen anytime. Even if you go at 9 o'clock, your wife will flare up in the same way. It is a mid-treatment flare up is just like that. If in the middle of the appointment there is a flare up, patient won't understand why the pain is coming out. So you have to assess why the flare up is coming, whether my pulp is not completely removed, why the flare up is coming, whether my antibiotic, the condition of the tooth, what the infection of the tooth, am I treating it properly? Am I giving a proper antibiotic? If I'm not putting treating the anaerobic bacteria, there's no point in just giving an amoxicillin and clavulanic acid or something like that. We have to think in that way. We have to think about all the bacteria present inside the root canal, and then we have to treat them. The flare up is very important. You have to manage both psychologically and medicinally. Flare ups have to be taken care of by the clinician. Patients get annoyed if they get flare up. They will think they will go to some other dentist. They'll ask something else. Some patients don't won't reduce. Some patients psychologically feel that even after the flare up is come down, they just keep thinking about that. They're psychologically so disturbed. Nowadays, in COVID, post COVID, everything is scary. They even if you get a small sneeze, the patient is thinking I'm getting COVID. It's just like that. Nowadays, people are so inquisitive, seeing in Google. Google Baba is the best doctor for them, not us. So we have to be more precautious, precisely telling them that we are better doctors than Google Baba. Please listen to us. I hope I'm
I
not
think,
getting
yeah,
things
yeah, yeah.
kidding
Yes,
going
yes.
on.
So I think follow-ups are really important in such cases. I mean, handling a
Yes,
flare-up
yes,
through.
of course. Yes, absolutely. When there is a flare up, you have to have a follow. Not only flare up, I personally feel if I do a root canal treatment and if I start an access and send the patient, if I'm doing a multiple visit to endodontics, I will call up the patient immediately on that same day evening for a follow up and ask him how he feels. That is the best part of his day. He will think, yeah, doctor has remembered me. Even though I treat 10 patients, even though I treat 15 root canals in a day, all 15 members have to be called. That's the way of follow up you have to. That is the best way of publicity for you to get. The patient will feel so happy that you're giving him so much of importance. You have to morning you treated him, evening you're asking him how he feels. There you made his day. Won't you feel happy if the doctor is asking you, how are you, buddy? Is the pain still there? So that's the kind of follow-up you have to have, whether it is flare up or not.
Amazing. So now we have following situations. Irrespective of whether you are an endodontist or a general dentist, one cannot run away from the following situations. Let me know how do you encounter or what do you suggest to handle these following situations. Number one, how do you encounter people who ask you for discounts?
Well, discount, people asking for discount generally, an unknown patient coming and asking for discount, no discount. There is no discount because if you want to give quality, you have to charge. And if you are generalizing the discount therapy prospect, you have to maximum have a 5 to 10%. of whatever charge you are telling them, not more than that. I don't personally feel discounting is a good idea. Why should I discount? When I'm buying so many products, as I told you, I have talked about so many latest gadgets which I'm buying day in and day out. I'm using post COVID. I'm using so much of protocols for my sanitization of my premises, sanitization of my patient, my attenders, me myself. I'm using all the PP kits. I'm sanitizing them. I'm fumigating my premises. Why should I reduce when they are willing to pay lakhs and lakhs of rupees for a sneezing and coughing when admitted in the medical hospitals? Why don't they pay for a tooth when they are coming for multiple visits? No discount. And if they ask for discount, if the general public comes in, if walk-in patient comes into you and asks for discount, no discount. Yes, if there is a personalized relationship with you, the patient is related to you, or you are little having a personal attachment to him, then probably 10% you can give a discount. Nobody gives discount. Nothing comes free to you, man. I mean, your wife doesn't give you food for free if you go home. Everything is at a price. Everything in this life. Nothing comes free.
Ab-
Nowadays,
Absolutely,
air is not
absolutely.
coming free. We have to buy oxygen concentrators. Oxygen is not free. Water is not free. Everybody is drinking both Bisleri water. They pay 20 rupees. They don't bargain there. Why do you bargain here? So we have to explain them. To see God, there is no bargain. You have to pay to see God. There's a ticket for to seeing God also. There is a ticket to see a movie. There is no discount. So even for us also, there is no discount. You have to explain. You. That is the way you should practice. Your practice has to be built up by you. You will demand the. You will decide the factors in your practice. If you stoop down, yes, you will keep. The people will pull you. Keep pulling you. There's no harm in
Okay,
sticking on to your rules. Next.
okay. So how do you encounter, or what do you suggest to people who bargains with you or at your practice?
Yes. First of all, as I said, we will explain to them what kind of treatment modalities we are using, what kind of latest technology we are using, what kind of materials we are using. We can show them. People will understand. If they are bargaining, yes, let them bargain. But I will explain to them what kind of latest materials I'm using, how aseptically I'm doing the treatment, how cautiously, meticulously taking radiographs, quickly, every step, and people are paying for it. I'm not great endodontist. I mean, there are so many endodontists in the market along with me. The new budding endodontist, my student who practices in a very small town in Assam. He's doing beautiful work. He's evolved his practice in just. You might be knowing Dr. Rohit Chadha. I'm very proud to say that he's my student. He does very good endodontics and he's charging very well. In the same way, when I'm doing quality, I have to charge. I can explain to them if they are bargaining. Yes, as I said again, the discount factor is again it's a personalized issue. Don't generalize it. If you keep it personalized, if it is yes, you are close to me, you are a fellow worker, my fellow medical colleague is there. Yes, I can give some discount.
Okay. And what do you suggest on window shoppers?
Window shoppers will be and they will continue to be window shoppers. Don't entertain them in your practice. You, if a window shopper, you can identify a window shopper if he is not willing to come to you paying a basic consultation fee to see you and get a suggestion from you. Do you think that he will pay you thousands of rupees to get a root canal or an extraction or an implant? No. So there is no, even if I go for shopping, I'll just go to see a couple of showrooms, will not buy any shirt. There's no point. That fellow will not, you see the fellow who is showing me the shirts will know me. He will identify me in a minute whether I will buy it or not. In the same way, you also have to identify our patients who are window shoppers. Window shoppers are not to be entertained. Never mind. Even if you lose the consultation fee, even if you lose that person, that patient won't come back to you. He will be a window shopper forever.
Okay. So I would want to know your best marketing strategy that has worked excellent for you over the years.
Well, marketing strategies. are different ways. People who are newly practicing these days in 2021 post COVID, if a guy is starting up a practice, they are thinking about marketing strategies, different ways of marketing strategy. There are so many social medias platforms. There are so many ways of marketing yourself. But the best way till date is word of mouth. Word of mouth is the best marketing strategy. If you do a quality job, if you do a good job, good work, without any pain, the way you handle the patient, the way you sit with them, the way you talk to them, the way you counsel them, everything matters. Then that will market for yourself. Yes, you have to have, nobody else will talk about you. You yourself have to talk about yourself. So we have to market on a Google page. You have to market it on Instagram. You have to market it on all the social platforms, Facebook. There's no harm in marketing yourself. You can put it on your general WhatsApp groups and educate your flats WhatsApp group. There are so many WhatsApp groups these days. You can put all your work there. You can show your equipment. You can show your clinic, the premises. Yes, that will give you a good marketing.
How important is having a goal in life?
Goal in life. Well, everybody should have a goal in life. One should have a goal after practicing, after becoming a dentist. You should have a goal to have that passion in your own profession. You should have passion towards dentistry so that you will flourish well in dentistry. If you don't believe in yourself, if you don't have the confidence in yourself, and if you don't believe in your profession, you can't achieve your goal. Goal is a must. Everybody
Okay.
has their own goals.
Okay. So we all know we enjoy being a dentist and we enjoy dentistry. But if I were to ask you, what is the best part of being a dentist? I
Best part of being a dentist is it's a very uh, fresh, latest, and aesthetic job. It is it is dealing with the most vulnerable portions of your body, which is it is dealing with all the latest materials. You can handling things, and it is very meticulous and skeptical. I mean, very precise job, which is very good, aesthetically, cosmetically renowned. No emergencies. Most importantly, there are no unless and until if there is a mishap and some mishap, which is very rare in our profession. So dentistry is good. One should believe in dentistry.
That's a very optimistic and very nice answer.
Yeah, of course. Yes, we should be
So,
optimistic.
yes. So as we all know, there is always a work-life imbalance in a doctor's life. How important is it, and what is work-life balance to you?
Well, every person, whether it is a doctor or anybody else, whether it is a dentist, we should have a balance in work and life. We should never combine both the things together. Work should be work, and life is totally your work should not be your life. Life is totally different. You should enjoy. One should have a passion of something else. Like one should have an affinity towards music or any other passion like photography or traveling or some other, and that's how you should spend life. Work is not your life. Work is work. You should worship your work, but not life should not come into your work.
Okay. As we all know, dentistry is considered to be one of the most stressed profession. We all know about this. So how do you de-stress yourself at work?
At work, yes, dentistry is stressful when something goes wrong with you in your profession. When sometimes you feel frustrated when you don't get, as an endodontist, when you don't get a canal, when you don't tend to get a instrument retrieval, when you don't get to take out a tooth, which you think it is very easy to remove a tooth, and that will show you starts. You cannot remove that particular root stump for hours together. It is stressful. De-stressing at that point of time is best thing to do is avoid that procedure for that day, cut it off, and then take some time for yourself, get back to it again on another day or even after some time. That's the best way to de-stress. Listen to some music or stop that work at that point. Instead of spoiling it more, better cut it at that level and get back to it on another day.
Amazing. We all know patients are always stressed, worried, sometimes agitated before a dental procedure. How do you de-stress your patients, and how important it is to de-stress a patient before a procedure?
That that is done by your counseling. The way you counsel the patient before he comes and sits onto your dental chair, the way you treat them, the way you talk to them, the way you handle them is a must. That is patient counseling and patient caring is very important to de-stress a patient who is apprehensive to come into dental practice, who's already had a bad experience earlier in his life going to a dentist. So you have to give him an assurance from your side that nowadays the techniques, the procedures, the methodology, the treatment plans, the technology has changed, and you're going to do a painless job. So that's how you should counsel the patient and de-stress him.
Okay. And as we all know, motivation is fuel and one needs it on a daily basis. How do you motivate yourself on daily basis?
Well, I every day morning I go to the clinic thinking in a positive note, very optimistically thinking I will get a good number of patients today. I will do a good job, whether it is root canal. I might look forward for doing a new kind of procedure like implants or basal implants or any good processes, whether it is any kind of treatment. I take it in an optimistic way and wait for it. And I take life as it comes. Even practice, you take as it comes. Don't fall, don't go behind money and don't go. Money will come automatically. But do your job with passion and commitment, consistency, and that's all.
Okay. And my question before we end this beautiful and awesome session, how what is the importance of taking uh, documentation? If I were to ask you, importance of taking case procedure pictures or documentation, so how important it is?
Document nowadays in present scenario in whether it is pre-COVID or post-COVID, documentation is the most mandatory thing in our dental practices. We have to document our each and every procedure. In fact, I would tell that you should document each and every stage of your procedure, whether it is a aesthetic procedure or a cosmetic procedure or a root canal procedure or an implant or an extraction. It's better you document your procedures. It is good for both you and the patient. It is good for you to educate the next patient. We can show just the pictures and documentation what you have done in your phone. You can take the photographs. Nowadays, the cell phones are so beautifully technically so advanced. We have so beautiful cameras in the cell phone. Previously, I used to have a digital SLR camera to take photographs. Dental digital photography is an art. You have to take photography of your impressions. You have to take photography of your models, molds. Everything has to be documented. It's a very good thing.
Right. And doctor, we have come to an end of this beautiful session. So before we let you go, I would ask you what is your message on our mission of Wise Dentist. That is, we are trying to help dentists by de-stressing, motivating, empowering, and inspiring them through a beautiful and awesome conversations with a very successful and renowned doctors like you. So, what is your message to us?
Well, I would give this short and sweet message to all the budding and upcoming dentists. First of all, students nowadays are losing interest in dentistry after they complete their graduation. I would tell them have faith in dentistry. First of all, believe in dentistry, be optimistic, start your practices, learn advanced courses like root canals and implants and all, and start up your practice. And you should keep three things in mind, entire lifestyle into your practice. Three C's, I would suggest three C's. One is consistency, next is confidence, the third one is change. You should be very confident in yourself in treating the patients. You should be confident in talking to the patient. You should be confident in explaining them to the treatment plan to them. You should be confident of all the things you know. You should they should feel that you are confident. Next is consistency. You should have a consistency in terms of your work, in terms of your procedural intricacies. You should have a consistency in your technologies. You're using your all your aseptic procedures, and you should next is the change. You should change yourself as and when the time changes. The practice you should not practice in the same way as you started your practice. You should keep changing. You should admit the various technologies in the market. You should adapt to the various technologies. You should keep changing your practice. In your appearances, you should keep changing your ambiences, clinic ambience. You should give a change. Patients should know that you're changing, so they will also accept your change. So these three C's are must for any dentist, and they would flourish in a very good way.
Okay, thank you so much, sir, for sparing your valuable time with our tribe. This session has in person given me a lot of wisdom, and I'm sure that this session will inspire many among the listener, and listener will have to take a lot out of this session. So I look forward
Thank
seeing
you.
you
Thank
again
you.
in person at earliest.
Yeah, thank you very much for giving me this opportunity, this splendid opportunity to talk about dentistry. Well, in an era of people where they're losing hopes on dentistry, please don't lose hope on dentistry. Dentistry is a very good subject, and you should have passion towards dentistry, especially endodontics. You should have passion to do a good root canal, so you will do very good. You can have good life, you can make good money, and you will enjoy your profession. Thanks a lot, Dr. Ravi. Thank you for
Thank
talking
you
to
so
me,
much, sir.
giving me this opportunity.
Thank you.
Hope to
Thanks
see
a
you
ton,
soon.
sir. Thank you.
Thanks.
Same
Thanks.
here.
Bye.
Bye.